do this with you. So yay. All right, we are live. Yes, on July 4th, Independence Day. We are having a live just for you. This is the voice and the face of Dr. Tolu Olabinto. I'm the CEO and co-founder of Living Spring Family Medical Center in the amazing city of Mansfield, Texas, where we help our patients live long and well because we believe the quality of life is just as important as the quantity of life. I'm very excited today to have again on the show Dr. Amanda Adkins. I'm going to be talking about the topic, Doc, my cholesterol is high. Why should I care? And how can I fix it without medications? Doc, thank you so much for coming. How are you?
I'm great. Thank you so much for having me. I'm so excited to be here.
Awesome, awesome. This is the second time you've been on here. It's been over a year now, so I'm glad you agreed to do this and to do this on a holiday. Um, it's all good. So we're gonna make this work. If you're watching live, hashtag live. If you're watching replay, hashtag replay. And that being said, Doc, I'm gonna kindly ask you to introduce yourself, please. Who are you and what do you do?
Yes, so I am Dr. Amanda Adkins. I am board certified in both internal medicine and lifestyle medicine, and I am the owner and CEO of Enlightenment Health and Wealth, where we help Christian women who are overweight get off their blood pressure and diabetes medications safely so they can live out their God-given purpose.
Awesome, awesome. I love your I help statement. But Doc, why do you do what you do?
I do it because my own wellness story. I actually started back on my wellness journey when I was a freshman in high school, weighing 199 pounds, and I vowed to never let two be the first number of my weight. And so I was on a journey trying to figure out how to lose weight and keep it off. And as I grew older, went through medical school, residency, and training, that I was seeing my own family actually suffer and die from like heart disease, diabetes, cancer, stroke. And I was like, there has to be something else because I know that I have those genes. And if I don't change something, then that's going to be actually my story. And I actually saw someone recently post on Facebook that it ran into my family until it ran into me. And I was like, ooh, that's powerful. Cause I was like, I don't want it to run into me. I want to do something different. And so I learned more about lifestyle changes to make so that I can actually be healthy, not just a healthy weight, but actually a healthy body, mind, spirit, and soul. After learning it for myself, other people would ask me about it, and especially patients. They're like, oh, doc, I don't want to be, like I said, I don't want to be on any medications. What else can I do? And so I was like, let me see what else we can find out that, you can do besides medication. And so there comes the journey of actually lifestyle medicine, where they actually focus on, the 6 pillars of lifestyle that you can change to actually help either prevent or reverse chronic illnesses. So that's why I'm here.
I love what you do. I love the fact that your lifestyle medicine bordered as well. You help people use food and lifestyle to help improve their quality of life and their quantity of life. So let's talk cholesterol. I'll be honest with you. Cholesterol doesn't hurt. High cholesterol doesn't hurt. We can agree. Doesn't make your head hurt. Doesn't make things happen. So sometimes I'll be honest with you. It's kind of hard to explain why having the cholesterol be a little bit better is not just for me as a physician looking at your lab
Right.
results, but it's also for you. So, Doc, why should we care about cholesterol? Why do we care?
Yes. So cholesterol plugs up our arteries. So just think about what we have. Our arteries are our lifeline. We need that to actually pump through our body to actually, or pump blood through our body so we can actually get the nutrients and oxygen that we need. So if it's clogged up, you think about your, plumbing in your home. If it's clogged up, things will not come in and out like you need it to actually flow. And it will actually, clog it up and then end up having a heart attack or a stroke. And again, like you said, it doesn't hurt. People don't realize what it does. They don't feel better when it's lower. They don't feel better or worse when it's higher. So some people are like, oh, it's just a little bit high. I'll be okay until you have a stroke or a heart attack. And some people think, oh, it's just for people that are older, heart disease for, old people. But actually your first signs of, like high cholesterol or heart disease can be young as adolescence, like age of 10. You can have fatty streaks, which is the start of, plaque buildup, which is the cholesterol in your arteries. And so you can't just say it's a disease of old people. it is something that you start when you're younger. And if you don't change it now, then it's just going to continue to build up, build up, and build up. And even with that, like a lot of people think it has to be, almost significantly closed off before you actually would have any of these symptoms or diseases that will occur. So heart attack or stroke, we learned, even back in medical school, where the plaque that's unstable, it can be 30% blockage and you can still have a heart attack, and you can have a fatal heart attack. I mean, there's some, men and women in their 40s that are dying of heart disease. It's not just the 80s and 90-year-olds. So it's definitely important. And when your doctor tells you your cholesterol is high, you definitely want to take it seriously.
All right, awesome. Thank you for highlighting that. And I love how you explain it relating to almost like blood, water flow through pipes from a water reservoir, right? It clogs up over time. So it's really important to make sure your cholesterol levels are better. Now, let's talk lifestyle tips. So I have someone who's watching like, I don't like taking medicine. And I want to know what are things that I can do to help lower my cholesterol. The more specific, the better, Doc.
Yes. So I would say the biggest thing is you want to not eat cholesterol rich foods. So you have to think, okay, what is that? I don't know what cholesterol is. So animal products, so animal meats, especially like organ meats, beef, pork, even chicken and fish has cholesterol in there. Eggs have cholesterol in there. So those types of foods, if you're eating those, and even if you're eating a little bit of all the different ones, it's still cholesterol. Your body still sees it as cholesterol. Because I have a lot of people that say, oh, I just eat beef every now and then, or I just have, eggs or egg whites. So you would still be adding that up in your body, and it would build up in your arteries as plaques. So you want to try to eliminate all those as much as possible. That would be the first thing, cholesterol-rich foods and saturated fats. So that would be like our cheese, dairy products, whole fat milk. All those things can cause you to have plaque buildup in your arteries. So you want to be very careful with those. So if you just cut those out or decrease them as much as possible, if you can't avoid them altogether, you would want to do that. Trans fats, like processed grains, like our desserts, our hydrogenated like the butters and things like that, you would want to be very careful of, because all those contribute to your cholesterol. So you have to be, again, careful with all those. And if you cut those out, you'll see your cholesterol come down. So that would be the biggest thing I would say. And I'm not, I'm a plant-based person, but always people are like, are you hating on my meat? I'm sorry, but you asking me about cholesterol, so I gotta tell you, like if you want it to come down, you gotta definitely stop that and reduce it. Yes.
All right, awesome. So I love that you said also you could reduce it, because I have someone who's like, yo, you messing with me on July 4th. You're messing with my meat.
My ribs on the barbecue.
Ribs, like you're extra, like you're really taking me off. And I've had clients, I have patients really upset. Like, what's with you and meat? I'm not going to become vegetarian. I'm not going to become vegan. Like, that's not my thing. So to that person who's watching, who's like, Doc, yes, that's not what I'm called to do. To not eat meat. What are tips to help reduce it? Because now it's like what the brain is going to tell you, for those of you who are watching, is going to be like, ooh, they're taking away something precious from you, right? Reduce. So that already triggers something in the brain that says, oh, they're withdrawing something from you. They're depriving you of some sort of pleasure. What would you say to someone who's like, okay, knowing that I don't want to take medicine, my cholesterol is high, there's a family history of heart attacks and stroke, but I need to correct this, even if I'm doing it in conjunction with medication. Now, in relation to eating meat and reducing that, what would you say to that person who's like, Doc, help me, come on, this is not making sense?
Yes. So first, I just got to have a heart-to-heart with them and be like, okay, and it depends on how high their cholesterol is and like their risk for actually having a heart attack. So sometimes I can be, very nice and like, okay, let's see, maybe just have, one a day and see how that goes, or on the special occasions. And then other people that's like, you're having a heart attack tomorrow, we're stopping everything. No, I'm just joking, y'all. But to definitely help to reduce. So you want to think that it's not depriving you. You want to see, what am I doing actually for my body? Okay. So you're like, okay, I don't want medications and I don't want to stop the meat. And I'm like, okay, we got to pick one or the other, because either you're putting cholesterol in or we're trying to take cholesterol out. So what are we going to do? And you can start out by just making like the meat the side item on your plate instead of the main dish. So most times, especially in America, we have our meat and then we have sides. So instead of having our vegetables as the sides, we want to make our meat the side dish. And if you just rethink that, so then you're like, I'm not deprived. I still have my meat here on the side, and I know that I'm going to have it, but I know I'm at least reducing the amount that actually can help me reduce my cholesterol. So, like you said, it's just a mind shift, a plate shift. What you will actually, how you would look at your plate, and most people respond to that very well, especially if they're huge meat eaters. So, if you just put it as a side, they still feel like they're okay and can and actually get through it and make it through and actually decrease their cholesterol that way.
Okay. And I like that we're having this conversation because what you're doing is putting power back in the hands of our guests or our viewers. Like these, now you have what we call an informed consent. You're saying this is what this contains, this is how I can adjust it. So make the meat the side dish. I also like the meatless Mondays or meatless Tuesdays where maybe one day a week you just say you're just not going to eat meat. And
Mm-hmm.
try it. You'll be surprised because then you become more aware of other things that you can eat that's good for you that can also lower your cholesterol. Now, that being said,
Yes.
um, let's talk other things. So we talked about cutting down on animal products. For those watching, cheese is the number one cause, one of the number one causes of high cholesterol in the U.S. So cheese is heavy. It's heavy in cholesterol. So know that so that you can make the changes and adjust what you put on your plate. Are there other foods that we can do? Let's say we're cutting down on the meat. Are there other foods we can do to eat to reduce our cholesterol, doc?
So yes, the flip side to that coin is you want to add in more fiber, and fiber comes from our plants. Okay.
More fiber, more
Oh,
plants. I didn't say it. Um,
oh,
she did.
oh, I was like, what happened? I just saw you shake your head. Okay. So fiber plants, they are full of nutrients. So if you actually have a diet that is low in fats, low in cholesterol, high in fiber, it actually has been shown to decrease your cholesterol almost as much as a low dose statin. So if you have that, you're definitely on the right track. So a lot of people are like, okay, if I don't have meat, how am I going to get protein? So I always emphasize, you have beans, you have soy protein like soybeans, tofu, um, tempeh, green beans, green peas, legumes like lentils. So there's so many things that you can do, and especially like legumes and lentils that you can always use that as a substitute for meat, and in some dishes you wouldn't even know that it's different. So if you look at that, and like I said, on those meatless Mondays or Tuesdays, or the whole weekend, whatever you want to do, you can definitely try that out and see what you are doing to actually help decrease your cholesterol. So the more plants you add in, and the less animal-based products, like you said, especially cheese and beef, that would be good. And I just want to put this plug in because people have the red meat. And when I say meat, I mean, every animal product. And then some people, when they say meat, they only mean red meat. So I always like to emphasize that poultry, like chicken and turkey, still is high in cholesterol. It may not be the highest amount of cholesterol, but that's still cholesterol because the marketing industry really has pushed, that white meat, that chicken is so much better than beef. But when we're looking at cholesterol, we still have to be careful with that. So just be conscious of that also.
All right. So now my next question is little segue to this. So let's talk those who eat out often. They're like, Doc, I don't have time to meal prep. I don't have time to cook. I eat out often. Are there ways or what are things I should be looking at when I go out to eat to help me lower cholesterol strategically, like in choice? And I say that because we're in Texas. And when I used to live in the Northeast, when I would visit Texas or the South, I'd be like, man, their food changed. Like the food tastes better here. Um, I got to find out having lived here because I asked some of the chefs, like, what makes it taste good? There, it's more butter rubber here.
Like
And
with butter, oil, fat.
oh
Yeah.
my gosh, wow. I mean, so now I understood now why it is. But are there pointers, for those who say, okay, I eat salads every day, or for those who say I eat out every day, what are things that I can do when I'm going out to eat with friends that's still cholesterol friendly, low cholesterol friendly?
Yes. So I want to emphasize that, like you said, it tastes better because that's what a lot of people, they're like, oh, I go out to eat. Even my husband says this. I go out to eat because the chefs are so much better than I am at home. But it's either high fat, high salt, or high sugar. And they get that taste bud that sends that signal to your brain that keeps you coming back for more. So it's only good on the taste buds. It's not good for the rest of the body. So we want to first look at that. The tips I usually have for people that eat out a lot is to look at the menu before you go. So that way you're not sitting there hungry, like, and everybody else is ordering their food and you're like, oh, I don't know what I'm gonna do. So if you look at the menu ahead of time, you can kind of figure out what would be the healthiest option for you there. A lot of times when you go, you can kind of, be nice to the server, and then even sometimes ask the chef to come out and say, oh, I'm really watching X, Y, and Z. So for me, I'm plant-based vegan. So what can you do that would not have, a lot of butter, oil, or animal-based products? And a lot of the times, the servers have to know the different things on the menu. So they'll be able to say, oh, we can tweak this. You can take this off here and do that. Don't be afraid to ask. Like I learned this from my husband that's not plant-based. He's vegetarian, but not plant-based. He said, why are you always ordering off the menu? You can pick what you want.
Wow.
So that was like so eye-opening and freeing for me, because I'll be like, oh, I can't go there because they don't have that. He's like, well, just tell them what you want. If they have a kitchen in the back, they definitely could do it. And I was like, okay, that's so true. So, I mean, you can be nice, leave them a great tip, at the end. And if you frequent the restaurant, then they'll be like, oh, I remember you like this way. And so it's not like you have to eat at home all the time. You can definitely eat out, especially now with the pandemic restrictions being lifted. Everybody wants to be out of the house and, be with friends. So you definitely can do that. So don't be afraid to eat out. Just work with the menu and then adjust to your own dietary needs. Like I said, a lot of the restaurants are now doing that nowadays for people. And so, yeah, just speak up. And it's easier than you think to do. And at a lot of restaurants. And a lot of restaurants now are being more plant-based friendly because they hear, like we're out today talking about it, but it's actually all out in the media more. So they're really trying to bring in that those patrons into their restaurant. So they definitely want to make you happy, so you can do it.
Awesome. And remember, you're paying for the service, so it's okay to ask for what you want. This is good. Another tip. Let's talk salad and salad dressings a little bit. Years ago, I had a patient came and see me. He's like, "Oh, doc, you said to eat salad. I've eaten a lot of salad, but I'm gaining weight and my cholesterol. What's up?" So let's talk. Is there a way, or is there something that we should be aware of when it comes to salad dressings and the gooey stuff that goes with the veggie trays?
Oh, okay. Yes. So that's like oil and fat. And so I ask that question also when people say they eat a lot of salads. Do you put salad dressing on there? Because it's usually smothered. So then I say, so you have a little bit of salad with your dressing, not the other way around. Because if you look at it, it's like the serving size is like a teaspoon or a tablespoon. And most people use like a cup on their salad. So we definitely want to be conscious of that. You can actually bring in so many different like fruits, add in different types of vegetables, different color of vegetables, add in different grains and beans, and maybe like a bean dip, like a hummus, instead of adding in a salad dressing. And it actually will be very good and very filling without that extra oil in there. And you just have to, put more things on it. And I actually learned this when I was traveling at an airport, and, I'm in the Bay Area, California, so they're very vegan friendly. And to see that there was a salad there, and just to add those things on there, and they had salad dressing on the side, but I was like, I'm going to taste this without it. And I'm like, oh my gosh, because of all the different like veggies that had the different tastes and different fruits that were there, you didn't even really need a salad dressing, because most time people want that because they feel like the actual greens are too dry. So if you add in those different things, you'll be very surprised. But if you feel like you have to have a dressing, definitely be conscious of the amount that you're putting on there, because most people use a lot. And sometimes people do use the vinegar and oil. Like I said, the oil you want to like leave out. You can do balsamic vinegars, not vinaigrette, but just vinegars, and that will also help also for your salads so they don't feel like they're dry, but without the oil and the saturated fat that's in there. So those are tips I would say you would want to try.
All right, awesome. And you can use the fork, dip it in the dressing, and pick it up as opposed to pouring the whole thing. There are little hacks around it. And we're having this conversation is not to take you off. That's not our agenda, but to have you understand exactly what you're eating so you know why certain things are the way. So you're empowered to make better decisions that change. I have been salad dressing free for almost 5 years. I don't eat salad with dressing, but I put other things, tangerines, squirt of lemon, leftover chicken, Doc, to eat. Yep. On the spectrum of eating healthier, add more fresh fruits and vegetables. You've heard it over and over again. All right. Now, what are there natural remedies that you can suggest to help lower cholesterol? We talked about the increased fiber. We talked about cutting or reducing animal products, but are there other natural remedies that you would suggest to help lower cholesterol?
So yeah, so I like omega 3s like flaxseed, ground flaxseed oil, um, ground flaxseed, not oil, ground flaxseed. Garlic is good also. So those would be two big things that I do. I would also caution people with natural like supplements. I don't
Mm,
like to say too many supplements because one, you don't know what you're actually getting in most supplements. If you just actually buy it from like your local grocery store or something like that, because the vitamin and supplement industry is not highly regulated, you
mm,
don't necessarily know that that's what you're getting in there. And of course, they have on there like lower cholesterol, but it also would say not FDA approved statement or something like that. So if you actually focus on eating the whole food more than actually trying to get the supplement, because you can't have a beef steak with a capsule of fish oil and think that's going to help your cholesterol. Because most time people try to do both, and you're not going to see a difference that way. So we don't want you to do that. We want you to decrease other things like we were saying, but then increase some of our other natural foods that would help decrease your cholesterol.
awesome, awesome. Now, one more question before we wrap up. How about exercise? Where does exercise come to play when it comes to lowering cholesterol?
So cholesterol, if you look at your lipid panel, like what your doctor would order,
Mhm.
there's different parts of the lipid panel. And the only real aspect that that exercise helps would be your triglycerides, and that's more aerobic exercise. It does not affect really your bad cholesterol, which that's one of the big ones that we want you to actually decrease to decrease your risk of heart disease. But we also see that triglycerides have been found to contribute to heart disease also. But exercise, aerobic exercising, like your running, walking, brisk walking, tennis, jogging, hiking, swimming, those types of exercises can help decrease your triglycerides. Again, you have to actually change your diet to decrease the bad cholesterol.
Awesome. I love it. I love this is a very well balanced conversation. I love it. And to wrap up, this session, I want to ask, I have someone who's watching who's like, oh, man, this sounds this sounds a little tough, doc. And I know I got to reduce my cholesterol. I'm already on medicine, and the doctor's talking about going up on it. What would you say to encourage someone who's watching when it comes to cholesterol and lifestyle changes on how they can start this journey to become better, not just cholesterol wise, but also increase their quality and quantity of life? How would you encourage them, doc?
So I would just ask them, what are your, life goals? What do you want to be like, 10, 15 years from now? Do you want to be like on the side watching people enjoy life, or do you want to be the person actually out there enjoying life? Because that makes the biggest difference. Because when we have to think about what we're going to eat every single meal, sometimes we're just like, oh, I'll have a little bit here, I'll have a little bit there. But you want to think of your food as your medicine. So if you have medicine already, think about, okay, every meal that I take, that's my medicine. So is this really helping my body or hurting my body? I'm hurting my body. And sometimes that on your own conviction, you don't have to, think, well, oh, I'm going to the doctor in 2 weeks, but no, oh, I just saw her, 3 months ago. I don't see her for another 3 months, but I'm doing this for my own body. I'm doing this for my children, my grandchildren, and know that I don't have to have, this steak or, pork, today. Even if it's the 4th of July and they're having a barbecue, I can have, grilled corn and, salad, spinach salad with, mandarin oranges, because I know that, the next 4th of July and the 10 years from now, I'll still feel this great. And unfortunately, my family members may not say the same.
Mm, mm, mm. I love it. What's your why? What's your why? Put it in front of you and ask yourself a question. As you're eating, is this diet or is this food helping my body or hurting my body? Really, really important. Thank you so much, Doc. This was good. This was very good. Now, for those who are watching, who are like, I like this doctor. She's a straight shooter. She's vegan and she's doing the things. How can people connect with you, Doc? Either to have you come speak or to work with you as a client.
Yes, so you can find everything on my website is www.dramandamd, so DRAMANDAMD.com. You can also follow me on social media, Facebook and Instagram at Dr. Amanda Adkins, and my last name is spelled Adkins.
All right, awesome. For those of you who are watching live and replay, thank you all for the comments. I have put her information down in YouTube. You can see her information at the bottom of the screen and also in the comment section. So you can connect with her off screen as well. As always, thank you all for watching. Please share. Remember, caring is sharing on this July 4th as well. Tag people in the comments and forward this video to them to encourage them to make better choices for themselves when it comes to cholesterol and life in general. Thank you again, Doc, for coming. I appreciate you.
Thank you.
All right. That being said, have a good 4th. And if you or anyone you know is looking for an awesome ATHAR and a passionate family physician in the Mansfield, Texas area, I am she. Have a good one. Happy 4th, everyone. And thank you for joining. Thanks, Doc.